Eileen Veilleux The Fam here. Welcome to part 2 in the final episode on intermittent explosive disorder in our little mini mental health series. Now, before we begin with this, just two friendly reminders. Since this is the ending of this series, tomorrow I will have a poll on my Twitter page in my community tab for the next subject you want me to cover. Also, a friendly reminder that in this series you will hear keywords. Now, in this one, there is only 2 keywords, and I will state what they are. When I get to it, I will say keyword and then state the keyword, and I will also remind you at the end of the video. So make sure you watch the full video so you can get the keywords, because whoever has the keywords and enters them into the comments, along with a legit comment, please, will be entered into my 2,000 subscriber merch giveaway. Okay, so saying that, let's get started with the diagnosis of intermittent explosive disorder. To determine the diagnosis of intermittent explosive disorder, or IED, they normally do 3 different things. The first one is to do a physical exam. Excuse me. So they can rule out any physical problems that could be causing this. The second thing is they will do a psychological evaluation. The psychological evaluation is so they can get an understanding of what's going on, and they'll use DSM-5, which is the criteria that mental health professionals use to diagnose different mental conditions, and we'll go over what's involved in the physical exam and the reason, as well as the other 2. Okay? So, in the physical exam, the reason for it is so they can rule out any physical conditions or substance abuse that could be contributing to the symptoms of IED. And this could include lab tests, or like urine, or urine test or blood test or both. Okay? But that's the reason, because some drugs like cocaine, acid, PCP, a lot of hard drugs have effects that make you do that. Also, alcohol. Excuse me. I've noticed myself, if I drink when I'm upset, the alcohol just intensifies that feeling. So that's why they do these tests, to see if it's drug or alcohol induced that's contributing to it, or if there's another physical thing that could be causing it. Okay? The psychological evaluation, they'll talk to you about your symptoms, thoughts, feelings, and behavior patterns. This way they have a general idea where to start. They need to have information so they know, just like you need to be educated with it. Okay? And then the third one is they use a DSM-5, which is a diagnostic thing that they use, all mental health professionals use, that was published by the American Psychiatric Association. Okay, now the treatment for IED, there is no single treatment for IED, by the way. There's none. There's a number of things involved in it. It's not just one thing. Okay? So, knowing that, the treatment will generally include keyword talk therapy and medication. The talk therapy is also known as psychotherapy. The psychotherapy can be in a group or individual sessions that will focus on building skills. Excuse me, I had to swallow. That will help you focus um, on improving ways to handle what you're doing. A common new type of therapy is called congenital behavioral therapy, which helps a lot of people with IED. Okay, and the way it helps is it will identify which situations, it will teach you how to identify which situations or behaviors may trigger an aggressive response. Okay, hold on 1 minute. Okay, I just had to check something. Okay, it'll also teach you how to learn how to manage your anger and control inappropriate responses using techniques such as relaxation training, thinking differently about situations, otherwise known congenitive reconstructing, and applying communication and problem-solving skills. Now, there's different types of medications that may help in the treatment of IED. Some of them may include certain antidepressants, um, specifically selective serotonin reuptake inhibitors, better known as SSRIs, anticonvulsant mood stabilizers, and other drugs if needed. Okay. Now, there's another part of the treatment may be focused on controlling your anger, on learning problem behaviors by coping with anger in different ways, and teaching you how to practice them, um, developing a plan with you for to help you getting angry in different ways, like doing things like going for a walk. They'll talk to you about different things you can do when you start feeling this coming on. I can give you an example of that. My late husband and I used to always go by this saying, and I apply it to every relationship, whether it's a love type relationship or a friendship, acquaintance, it doesn't matter. Even with work, a lot of people blow up at their jobs, which is not nice. It's best to always have this behavior and go by this plan. If you cannot talk a problem out, then walk it out. If you're at work and you're having a major problem, well, arguing with it is only going to make it more heated on both sides, and you're going to end up losing. Okay? If you have a coworker that is starting to cause these feelings, walk away. Take a time out, take a deep breath, walk away. If it is your boss that's causing this, that one's a little harder to deal with. But evidently, if you have that type of stress, then you need medications to help bring it down. Because if you're at work and, a lot of people when they're working, they'll quit a job if they don't like it or if they have a small problem. But they don't have a backup plan. They don't have another job to go to. So they're hurting. So always try to remember, plan ahead, think ahead. Think before you speak and act. Okay? The plan may include improving your self-care, making sure you're getting a good night's sleep, because our body needs at least 8 to 10 hours sleep. Each body's different. So if you're not getting enough sleep, you need to make sure you let your doctor or mental health professional know so they can help you with that. Make sure you exercise. Um, and practice keyword stress management each day to help improve your frustration tolerance. Okay? Also, your plan may include avoiding alcohol or recreational or illegal drugs. And the reason for this is, as I said, alcohol, if you're already upset and you're drinking alcohol, it's going to intensify. Certain drugs can intensify or cause it, like PCP causes rage. Acid, you could go on what they call a bad trip and get you upset. There's a lot of different drugs. So the best thing to do is to stay away from, any illegal recreational drugs. There are legal means if you need help to calm down. CBD is legal in all 50 states. So no matter what state you're in, you can go to a head shop or a CBD shop and order CBD. If you vape, like something like this, they have CBD for vapes, but I don't have any. Um, they have CBDs in food, like brownies or cookies. And CBD can help you to relax. There is no THC in CBD. That's why it is 100% legal, and it will not bring anger, cause anger. It might help calm you down. So that is another option you can think of if you are dealing with IED yourself. Okay. Now, if you have a loved one that has IED, remember, unfortunately, a lot of people that have IED don't get help for it. So make sure you do what's needed. If you're involved in a relationship with IED, we are going to be covering the certain steps that you're going to be needing to do for your safety with it. Because remember, the violence is not your fault. You Nothing that a person does is ever your fault. You're only responsible for your actions, your words, your actions, and your thoughts. Not anybody else's. They're responsible for their own. Okay? Excuse me. But don't go and allow yourself to be mistreated either. Love can be powerful, but don't let it get to a point where you don't love yourself enough. Always put yourself first. The number one rule that God has is love others as you love yourself. And you can't love others until you love yourself. And if you're letting yourself get abused, you're not loving yourself because you're letting yourself go through that. And there's no reason for it. Okay? I'm going to go over some things with you that if you're in a relationship with someone that has IED, things you can do to keep you safe. Okay? The first thing you're going to want to think about is create an escape plan to stay safe if domestic violence should occur. Okay? And I'm going to tell you the key things that you're going to want to do for that. Okay? So one of them is make sure you have the number for the domestic violence hotline or a woman's shelter. Get advice from them. Call them. You don't have to leave the person, but walk away from the situation and talk to somebody. Call the hotline or call the woman's shelter and get advice. Okay? Um, when the person's not there, don't do it when they're there. If you can walk away from the situation, walk away from it. If it's an on-continuing thing and they refuse to get help, though, you need to take steps to ensure your safety. Okay? If there's any firearms